Okay, thank you for the attention. We are from SGD BH. We will present our student project. The title of our student project is Article Review, Cohort or Aspect Therapy, Scenario H. Next.
For the introduction background, diabetic neuropathy develops in diabetic patient, which is the cause is end-stage kidney disease and also high risk of cardiovascular mortality. Diet therapy in treatment of diabetic neuropathy, which has a low protein diet, can delay the progression of end-stage kidney disease in diabetes patient. Blood pressure control and optimal glycemic control can slow down the progression of diabetic neuropathy through renin-induced tension system blockade. So for the problem, a 40 years old patient had diabetes mellitus for 6 years and also had mild decrease of renal function, which is secondary to diabetic neuropathy. Doctor advised him to have a low protein diet to prevent the progression of renal failure, but another doctor advised him to have a low calories and normal protein intake to maintain his nutritional status. As he was confused, doctor didn't have evidence to show his patient. So for the purpose of this student project is to help this doctor to find evidence from the internet.
Okay, for the identify type of question of the scenario, type of question of the scenario is about therapy or intervention for diabetic neuropathy. The patient had a mild decrease of renal function and was confused about his diet to maintain his condition.
Okay, for the PICO of the scenario, the first is the population or the problem. The population is adult. Problem is decrease of renal function or secondary to diabetic neuropathy. For the intervention is low protein diet, and the comparator or control is nothing. And the last for the outcome is prevent the progression of renal failure. Next.
Okay, next for the clinical research question. Clinical research question is presenting the idea is to be examined in the study and is the foundation of the research study. The clinical research question for this kind of scenario or research according to the PICO is in patient with diabetic nephropathy with a decrease of renal function, is a low protein calorie diet necessary to prevent the progression of renal failure?
So next, for discussing the best evidence to answer the clinical question, based on the PICO and clinical research questions described above, we try to find the best evidence. So the one of the most common source, namely PubMed is one of the most common source that is free and paid Medline databases, leading to several databases of reference journals focused on science and medical topics. Medline is a medical journal database that index most of the published medical and natural science topics. PubMed is available online, free of charge, and fairly user-friendly when it comes to searching medical journal. The search keyword that we use to find the evidence are EDALs and diabetic nephropathy and low protein intake or low protein diet and renal failure. So for the search for journal on PubMed are found in the figures. Next. Next. From the searching, we found that there are 60 evidence from the PubMed, but and after that we filtered the type of research because we just focus for the type for the therapy type. So we filter for clinical trial, meta-analysis, and the mass control trial review, and also systematic review. After that, we found 11 evidence, and then from the 11 evidence, we met based on the cases. So we found two evidence to do the critical appraisal. The title of the both evidence are efficacy of low protein diet for diabetic nephropathy, a systematic review of randomized control trials, and also efficacy of low protein diet in diabetic nephropathy, a meta-analysis of randomized control trial. Next.
Next. So for the first article, the validity aspect. The research question first is the research question clearly defined and specific. The research question should clearly reveal the population studied, the type of intervention, the comparator, and the outcome assessed. Using the PICO mnemonic, we found that they use P for diabetic nephropathy patients, I is used for low protein diet, the O or outcomes can be seen in the clinical outcomes including glomerular filtration rate, urinary album excretion rate, glycosylated hemoglobin, serum creatinine, and proteinuria. And there is no C or comparison stated in the study. And then second one is the studies involved in the meta-analysis using an appropriate design to answer the question posed. In the study, they use randomized control trials. Next. The third one is the search strategy for relevant articles is clearly stated. It is stated that they use several electronic databases such as the Cochrane Library, PubMed, WIPO, CNKA, China National Knowledge Infrastructure, PangPang, and IMBAS updated to September 2018. As seen in the flow diagram, in the initial stage, there were 1578 articles that were successfully obtained through index words. Then after screening titles and abstracts, there were 94 articles that needed full text evaluation. 74 articles were finally excluded, leaving 20 articles entered into the meta-analysis for several reasons. Namely because there were repeat articles not using randomized control trials, review, or theoretical research, using rat in the experiment, and lack of data. And the fourth one is assessment of the quality of the studies included in the meta-analysis being assessed. JEDAT system to assess the quality of the studies included in the study. The scoring checklist to reduce the bias consists of 3 topics, namely dropouts, descriptions of blindings, of randomizations, and of withdrawals. The results are 7 articles each got a score 2, 9 articles each got a score of 3, and 4 articles each got a score of 4. Other tests to assess quality and identify potential bias are Beck and Mazumdar's rank test, Egger's test, and final plot. Next.
So I will explain about the next part. So there are several differences found. For example, population size like number of patients, participant characteristic like age, gender, BMI, and type of DM, intervention like amount of protein intake and period of intervention, and quality of study that measure using JEDAT score. These samples were highly heterogeneous, shown in the score of I-square that more than 50%, and chi-square test p-value less than 0.05 in all outcomes analysis. Next. There are several outcomes measured in this study. Here are some confidence interval of the outcomes. The relatively wide range of confidence interval and the fact that majority studies had small sample size indicated that there was relatively higher uncertainty. Next. The study is applicable for the patient in this scenario since the age range from 33 to 72 years old and had diabetic nephropathy complication. However, because of participants of this study comes from foreign countries, this result should be adjusted for Indonesian people, since Indonesian people have different demographic characteristics from this study's respondent. Next.
The next one, the advantages of applying the evidence to the patient and the disadvantages of not applying into the patient in this current study. For the follow advantages of this study are short some of the most highly similar characteristics in the LPD group and in control group. The results are proved to robust according in multiple of additional analysis and the data were considered to be completed. Next. The disadvantages of not applying into the patient in this current study, such as improve of efficacy could be garnered with the sustainable intervention and better compliance of the patient. There is not patient choice is related to the patient of the family decision. Availability takes into the account geographical, technological, social, and cultural aspect, and cost effectiveness consideration based on the advantages and disadvantages obtained and the patient choice state in the study.
Next. For the second article in the validity aspect, first from the search strategy, in the second article, they described that they use 4 databases, which are PubMed, Medline, Embase, and China National Knowledge Infrastructure to search for the article. And for the PICO itself, we can see that the use for the patient is diabetic nephropathy, and for the intervention is low protein diet, whereas compare and outcome is not stated in the article. And for the inclusion criteria itself, that they use for the systematic review are, the first one is if the article is published in full text, the second one is the use of a randomized control group, and the availability of the outcome data of changes in GFR or CCR and albuminuria or proteinuria in patients with diabetic nephropathy. And the exclusion criteria is also included, which is RCTs of crossover design. Next. For the risk of bias assessment itself, you can see from the table 3 that in this systematic review, they done the risk of bias assessment. And from the meta-analysis itself, it is presented in a forest plot in the study. Next.
Okay, now I will show you about the result aspect from the second article. As we can see that the results are intelligible, clear, and coherent. And there are 3 aspects that we can see: primary outcomes, secondary outcomes, subgroup analysis. And here we see the first outcome of the second article, that we found that significantly evident heterogeneity across the studies, but the final plot showed no asymmetricity. And based from the systematic review, the expected outcome from the low protein diet was changed in the kidney function and proteinuria. The first outcome didn't show a significant result evaluated from the GFR value. Next. And here we can see the second result. The standard mean difference was used to evaluate the changes in proteinuria. Based on the standard mean difference, there was no significant changes in proteinuria, and based on the clinical characteristic of the quality of the study, subgroup analysis was done in the systematic review. And based on the confidence interval, the results were precision as the interval was narrow. Next, sorry. So this is the picture of the final plot that show there is no asymmetricity. Next. From the relevance aspect, based on the patient's characteristics on the study, the applicability of the study is for the middle-aged, overweight, and obese, men and women. The patient's characteristics of the scenario are 40 years old men, so it can be concluded that the study is applicable. Next.
Okay. For the summary, based on the review of the journals that the author has done, it can be concluded that the results of these studies, which can be known, are that the current meta-analysis uncovers a powerful function of a low-protein diet in improving diabetic nephropathy. Be that as it may, the modest number of included patients may restrict the precise top-notch RCTs with a bigger example later on are needed to affirm the current discoveries. That does not associate with of function in patients with both type 1 or 2 diabetic nephropathy. Hence, the patient shouldn't take the first advice that was given by the doctor. This is our presentation for today. Thank you for listening.